You are about to listen to an episode of the SMA My Way podcast. Accessibility is important to us, so if you would like to listen along with subtitles, you can follow the link to our YouTube version of the episode description. There, you will also find the link to the transcript of the episode. So hello and welcome to this special episode of the SMA My Way podcast series. My name is Louisa Townsend and I am Patient Partnerships Director for SMA at the pharmaceutical company Roche. And today it is my pleasure to host this special episode discussing the recently published Care for Adults Living with SMA in Europe, a benchmarking report, which you can find on SMA Europe's ADISMA website. We are so excited to take this time with you today to introduce the report, why it was needed, and some of the key findings. And in order to do that, I am joined by two of the individuals who have been instrumental to the development of this report, Veronique and Jakob. Hi and welcome. Thank you for joining us.
Hello, Louisa. I am Veronique Van Asch. I live in Brussels in Belgium. I have a background in cellular biology and also a degree in management. For the past 20 years, I have been working for the Walloon Public Service, focusing on economic employment and research. Since I was 20, I have been actively involved in advocating for rare diseases, particularly SMA, fighting for the rights of people with disabilities for over 25 years. So I am also a delegate member of SMA Europe until 5 years, and I am representing also the adult committee of SMA Europe.
Thank you, Veronique. That's a long time contributing to advocacy. And Jakob, if you could introduce yourself.
Sure. So hello, everyone. I'm Jakub Gietka. I'm from Poland. Even though I'm still a student, I try to contribute towards the society as well as persons with disability and with rare diseases. So not only on the national basis, but also international one. I am a member of the SMA Europe Adult Committee Group and have been the member of expert advisory group that shaped the benchmarking report that we are discussing today.
Absolutely. Thank you, Jakob. And you both mentioned actually the SMA Europe Adult Committee. Veronique, maybe you could just tell us a little bit more about that committee.
Yeah, so the Adult Committee of SMA Europe is composed of 15 volunteer adult patient advocates who live with SMA, the umbrella organization of patient SMA organizations across Europe. The mission of the Adult Committee focuses on advising SMA Europe with the adult patient perspective. And also, what is very important, it's empowering the national organization and advocating for better care and quality of life for adults living with SMA.
Why is research into the provision of care for adults living with SMA necessary?
Yeah, it was necessary because there is a huge disparity inside the adult care provided in Europe. Each country has its best practices, its strengths and its weaknesses. Each country evolves differently and initiates stages of development according to political choices and the needs of patients. SMA is a complex and multifactorial condition that requires comprehensive and serious management. Also, medical and paramedical care, material and financial aid to enable everyone to have an independent life. That's very important. We are fighting for our independence every day. And so comparing good practices in each country allows us to draw inspiration from each other and move towards better care for everyone.
Absolutely. And I think I wouldn't be unfair to say that it's actually the pediatric care that has really driven some of the major improvements in care for people living with SMA and have been like the real focus on the shifts in standards of care. Maybe you can talk me through how that compares for adults.
So SMA is a condition that affects people of all ages, including not only children, but also teenagers, young adults, and older adults. We must support and give the best possible medical responses depending on the age and depending on the symptoms that appear.
And the numbers of adults are actually just increasing, right? So as you say, like as people stabilize, as we're aging, the number of adults living with SMA, transitioning into adult care are growing.
Yes, there are more and more adults because before the treatments, some of the children were not becoming adults, but now all those children will have an adult life. So the statistics are improving, but SMA remains a serious rare condition.
So why is the community concerned that adults' needs are being neglected?
In Belgium, the care provided in hospitals and rehabilitation centers is very satisfactory. I have never felt neglected. On the other hand, I have heard stories in other European countries or at the international level of patients that are left behind, who did not know who to turn to for treatment, who were treated very correctly in a region and not in another region of their country, for instance. These disparities are not logical. We must harmonize care and create optimal care in centers of expertise for SMA. So I can also here explain the Audisma initiative. This is a project within SMA Europe, and it was born from this observation, these disparities inside Europe. This is a powerful advocacy tool that is being built day after day. Audisma has one central message. This is no one is left behind.
And for those of you who may not have seen Audisma, it's a difficult word to spell if you've not seen it before. So it's ODYSMA. And how do you hope that a benchmarking report can help us tackle those gaps and those needs of adults living with SMA?
This benchmarking report provides an overview of the real situation related to the health equipment system and care provided to people living with SMA. It highlights the actions necessary to improve the situation and gives some possible solution and recommendation.
Thank you so much, Veronique. So Jakob, maybe I can bring you into the conversation here as someone who was so involved in the report. Could you maybe talk us through how the research was conducted?
The research for the benchmarking report was extensive and multifaceted. We started with a rapid literature review, which contained over 700 sources that were screened. Secondly, online structured surveys from 123 healthcare professionals. These responses helped us collect the necessary practices and standards in SMA care across different countries. And finally, we finalized it by conducting semi-structured interviews with patient organizations. So as far as I remember, there were 21 national organizations that took part into it. After conducting all of the necessary research, we decided to prepare 19 different indicators that could make the report more manageable to not only read, but also to digest. So basically, SMA Europe, together with Roche and the expert advisory group, we created, I would say, 3 main topics: the organization of healthcare systems, the topic of healthcare delivery, which included other indicators such as the multidisciplinary care. It's really essential to treat patients with SMA from different perspectives, as I would say, more in a holistic way. And last but not least, the governmental and peer support was, I would say, sort of a cherry on top on that, which went beyond the medical care and all of the, I would say, medical and healthcare proceedings. And we delved more into the living and the independent living of those with SMA, providing, for example, life assistance, professional caregivers, but also the access to employment.
Absolutely. Yeah. So I think what's really beautiful actually about this report is it thinks about care not just in terms of medical, but in terms of that, as you say, that independent quality of life that comes from a more holistic picture, and some of those social and sort of policy related topics that really influence everyone's everyday life, but particularly individuals living with SMA as well. And for those of you who are interested, you can look at the scorecard of your country, because there are country individual reports and not just a European sort of roll-up. So you can see how has your country done against these 19 indicators, and also then in the European report, how they compare to your neighbours, which I think is always a source of competition within Europe. So maybe let's now get stuck into some of the actual detail of these indicators. And I think the one you mentioned already, Jakob, that I think we've all heard stories about. Everyone has their own story to share about transition. So maybe you could tell me a little bit more about what good practice looks like when it comes to transition. So that moment where an individual moves from pediatric care to adult care and SMA.
I think the best way would be to bring some my own old memories. Basically, I remember the transitioning period as something really rapid, not only in the sense of being more aware and cautious about what's going on. And I would say entering the adult life is really something changing, a pivotal moment for everyone, especially those with rare diseases such as SMAs. I mean, there are disparities that we unfortunately have to take into account, and even within countries.
Absolutely. And I just want to double click on something you said about the disparities that exist in the country. It was really interesting when we got the survey results back from the doctors to see that doctors in one part of the country are doing one thing and doctors in another part of the country can be doing something else. So really, it's never just a simple picture of country A is doing well and country B isn't. It can really depend on which hospital or which centre an individual is actually being looked after by as to whether they get the good quality care that we expect from transition. Maybe you could talk me a little bit more through what the different factors involved in transition look like. What does good look like? What are some of the best practices that we've seen?
So basically, for sure, there are protocols, policies needed in order for the transition to be as smooth as possible. For example, when it comes to, I would say, one of the positive sides when it comes to the transitioning moment, I think in Poland there is a possibility, a body, an ombudsman who actually supports the transitioning period of all patients, not only those with SMA, but also other with rare diseases, right? And the framework basically is built on 3 fundamental principles. So strategically placing the patient within the healthcare system, then understanding the needs of each individual, and associating the developmental transitioning. So ensuring that everything is in place, and also, I mean, the patient is the most important part in each of these stories. So we have to keep that in mind, that even though the administration might sometimes be a difficult and challenging thing, that the health and the priority is on patient.
I think it's really nice to have a few best practices to know about, things to learn about. It gives us a bit of hope. I think especially when we encounter so many frustrating stories of poor transitions that individuals have experienced. And oftentimes the stories that we hear are about the differences in the quality of multidisciplinary care between pediatrics and then when you're in adult care, right? So the differences in level of support. So what do we mean when we talk about multidisciplinary care? So this is actually a healthcare approach in which professionals from multiple different disciplines, so different fields of medicine, collaborate together as a team so that they can provide comprehensive and holistic care to those they serve. And what's really important to consider there is the way in which those different medical professionals are actually coordinating between themselves, sharing the information, and there's one person who leads that multidisciplinary team to coordinate the approach. If there's no coordination, the time spent in hospitals or other healthcare settings can be disproportionately high, which can obviously impact other components of your daily life, such as your employment. So maybe turning back to you, Veronique, how important is that multidisciplinary care in SMA, and how are countries doing in ensuring that those adults living with SMA can access that care that they need?
A global approach is needed to offer the best care to the adults living with SMA. Multidisciplinary care is needed in order to offer the best reply to all the possible symptoms related to SMA. Communication between the different clinicians and paramedical workers, such as dietitians, nurses, psychologists, etc., is very important.
So really complex multidisciplinary needs for adults living with SMA. The thing that I would really want us to flag as well is that in approximately half of the countries, adults living with SMA have access to relevant specialists, but usually do not benefit from coordinated care via like a multidisciplinary team. It's not all bad news. And in this report, we do highlight some of the best practices that we observed in the provision of multidisciplinary care. Maybe, Veronique, you could share with us some of the best practices we found.
So first of all, in Greece, adults living with SMA have access to multidisciplinary team that include adult neurologists and other clinicians. However, this is not clear if a healthcare practitioner is responsible for coordinating care in these centers. So it's nearly perfect, but there is still something to improve. And in my experience in Belgium, multidisciplinary teams are present in all the neuromuscular disease reference centers.
Incredibly lucky for you to be in Belgium and be getting that really high quality coordinated care. Maybe something that other countries can look to improve the experience that adults have. So as Jakob mentioned earlier, I think what's really special about this report is that it considers care not just in terms of the medical components of care, but it looks beyond to the more holistic view of the individual and the care that's provided by life assistants, professional caregivers, and those informal or unpaid caregivers from family or friends is not only necessary, but really heavily contributes to the well-being, the independence, and the quality of life of an adult who is living with SMA. How did provisions vary across the countries?
Yes, Louisa, there is a significant disparity in Europe regarding access to life assistance. This is, for me, an injustice that leads to dramatic or very complicated situations when life assistance cannot be hired. The life assistant serves our feet, our legs, our arms, our muscles, the vital force that helps us to move and integrate into life. I participated to the International Congress of SMA Europe in Belgium, and I realized that there are so many disparities concerning the access to life assistance among the members and the adults living with SMA. For instance, countries like France, Germany, Denmark have the right to have a paid life assistant. And for instance, in Belgium, like myself, Russia or Poland, this is not easy and impossible for me. It is impossible to have a life assistant. So to attend to the conference of SMA Europe in Belgium, I had to ask the assistant of a friend who had to take time off to be there for me. So it was an informal help, and she was not paid. She had to take some days off, and it's not easy. And she was not trained to help me. I am totally not okay with that because we are not integrated in the society. And I think that the diversity is really important in the world.
Absolutely. Maybe you can help explain for me and for the audience, what are the kind of aspects of formal and informal care required for adults living with SMA to really be as independent as possible? What are the things that we should be thinking about?
When we are considering the independence living per se, we have to, as Veronique already told us, keep in mind that having an assistant is the necessity almost for everyone, not only with SMA, but also with other rare diseases that are unfortunately incapable of doing the daily activities. I think, unfortunately, it all starts with the money approach. I mean, having enough resources to cover not only the, I would say, workshops aspects, so giving enough data for all of those who would like to become assistants, but also for patients as well, because it might be difficult for them to hire such people on their own and also provide the necessary knowledge. It would definitely promote greater independence in their lives when they do have such an assistance alongside with them, because who would like to stay just at home without a possibility to go outside, meet with friends, visit different places around the world? It might be really, really, I would say, problematic to imagine, but for, I would say, majority is still the case. And I hope this report will be the pivotal moment for a change.
In terms of the findings of this report, Veronique, maybe I pass this back to you. What were the key findings around the financial assistance to hire formal care?
Challenges persist in certain countries, including inadequate financial support, restrictions on the number of hours or days available per month or year, and a shortage of professional caregiver or life assistant.
So now we have this very comprehensive picture of adult care for SMA in Europe. What are the next steps? How are we going to use this report?
So basically, the objective is to bring about political, organizational, and especially mindset changes to better integrate individuals living with SMA, enabling them to lead healthy lives and live independently. In my opinion, we can drive meaningful changes and create a better future for adults living with SMA. And we have to call on you to express your support for the recommendations in this report and urge the key stakeholders to turn these recommendations into actionable outcomes. I think it's the right moment to make the difference today.
That's inspirational. Let's make a difference today. So maybe, Veronique, you can explain to me how this report is a powerful tool for advocacy for use with various stakeholders.
Yes, indeed. We invite leading researchers and clinicians across Europe to join forces with SMA patient organization and the SMA patient community to define recommendations and protocols that address the specific needs of adults living with SMA. They should also cover all areas applicable across countries, like, for instance, multidisciplinary care, pharmacological treatment, outcome measures, training recommendations for physiotherapists and other healthcare practitioners, as well as the caregiver. This is very important too. This should also call on the national medical community to work on national chapter that should be country-specific. For instance, transition care is a national protocol. So they should also call out the current research needs and priorities for future advancing and improving diagnosis, care and treatments for adults living with SMA. Because some of the adults, maybe type 3 or 4, are not yet diagnosed and there are still gaps, and this is important to have the optimal care.
When I listen to you there, Veronique, I think what's really clear is that the policy actions that are being asked for in this report require everyone to work together, right? This is not just going to be something that one person or one organization can push forward. So as we're starting to wrap up, maybe you could share with me your most important or the call to action you are most passionate about from this report.
Okay, Louisa, it is not easy to choose because I have two important topics that are very close to my heart. So the first one is the accessibility. I think it's important for all the people living with SMA to be able to access everywhere, everything, the transport, the work, to be able to play, to go, I don't know, to go in a concert, to be free. And the other one is also, I think there is an inequality in Europe concerning the access to the treatments. For instance, from my part, I have the choice to be treated. And I am treated from 6 years. I was treated in 40 years old, and I am sure that those treatments stopped this disease that is a declining disease. And I am really sad for my colleagues, my friends, who have not the choice to be treated in some other countries in Europe. And I would love an equal access in all the world for the children, the adults, and everyone, because we deserve it.
Jakob, is there any call to action you're particularly passionate about?
I would say becoming more aware of SMA itself. I think there is still a need for not only the audience, but for the public to understand what it involves. I mean, as Veronique said already, the financial burden is huge. And sometimes I have a feeling that we as persons with SMA are being considered as people whose pockets are never empty, right? And unfortunately, this is the case that we need support from government, because otherwise it's really difficult. It would be difficult to live independently. And I think for me, as an adult living with SMA, the most important topic is, again, the accessibility to move freely without any obstacles, architectural ones as well, but also having assistance care. So the personal assistance, which not only facilitate the life of each of us living with SMA, but also helps us to think better about the future to come. Because normally being relied on just the family members, your friends, your, I would say, dearest and nearest so-called, it might be really difficult to tackle what the future can bring to us.
Thank you. And actually, we're coming towards the end of our time together. So, Jakob, Veronique, I want to say a big thank you for joining us on this very special episode of the SMA My Way podcast, for this whistle-stop tour of the Benchmarking Adult Care Report. For those of you listening who want to find out more, maybe read the report in full if you're feeling ambitious, or actually just take a look at your own country's scorecard. You can find everything on SMA Europe's DISMA website. I also want to pause and acknowledge that this project is a collaborative effort and shared outcome of a partnership between SMA Europe and F. Hoffmann La Roche Limited. And as a consequence, this report has been funded by Roche to make this happen, based on our shared ambition with SMA Europe to improve care in the field of SMA. I also want to thank all of the people who have contributed. It was a huge effort spanning more than 18 months to generate this report, and it would not have been possible without the invaluable contributions of the expert advisory group, of which Jakob was one of the members, the SMA Europe member organisations who were interviewed as part of the process, as well as the SMA Europe project team that gave many hours to this project, the healthcare professionals that responded to the survey, and then the agencies that supported it as well. So Weber Shandwick from Brussels and Hall and Partners. So a big thank you to all of those many contributors. We truly hope that this report will equip you and your local SMA communities with the information needed to ask for more for adults living with SMA in Europe. For more information on the report, please visit the DISMA website. That's spelled odySMA-europe.eu/adult-care. For more information on SMA My Way, please visit global.smamyway.com. You can also search for the SMA My Way podcast in your streaming service of choice and follow along so you're notified on the next episode's release.